The hosts and guests on Everything's Messy podcast are not licensed healthcare professionals. The discussions in our episodes are not personalized medical advice. Always consult a qualified healthcare provider for medical guidance. Never delay seeking professional medical advice or emergency assistance because of our podcast. We encourage consulting with a healthcare professional before making any significant health changes. By listening to our podcast, you agree to the disclaimer. Thank you for listening to Everything's Messy podcast. Hey, welcome to Everything's Messy podcast, where we celebrate the beautiful but messy life experiences that most, if not all, people go through. Get ready to embark on an exciting journey through the raw and unfiltered stories of everyday people. Here, we dive into messy realities of life, from making messy mistakes to triumphs and everything in between. Are you sensing a theme? That's right, it's messy. But this just isn't about the mess. It's about finding strength and resilience in the midst of it all. We'll explore how health, fitness, and wellness play a crucial role in navigating life's twists and very messy turns. And we'll challenge conventional systems, because sometimes the most unconventional paths lead to the greatest discoveries. Join us as we embrace the messy, beautiful, and endlessly fascinating stories. Each episode is a testament to the power of our messy journeys and the beauty that emerges from the mess. So grab your favorite beverage, coffee, sparkling water, whatever it may be, and prepare to be inspired. Are you ready? Let's get messy. Hey everyone, welcome back to another episode of Everything's Messy podcast. I am your messy host, Sarah. Joining me today, I am so thrilled that she has, have the time to come on our podcast. I have Dr. Diana Driscoll with us. She is an expert on POTS. She created the Driscoll theory. She is a therapeutic optometrist and clinical director, and she has a research company, Genetic Diseases Investigators, and that carries multiple patents, which is unbelievable work that you're doing. Welcome to the show, Diana.
Thank you for having me, Sarah. It's really an honor to be here.
I appreciate it. Look, this is there's a lot of things in the wellness space that I feel get attention, and then there's some things that I wish there was more attention to, and this is one of those things.
Oh, is that right? Well, COVID kind of brought some of that to the forefront because COVID is triggering POTS in something like 10 to 14% of patients.
Wow.
It helps with the validity. It just didn't help with releasing more information about what's driving it.
Yeah. So just to back up a little bit, if you could give just a brief summary of what actually is POTS for those who don't know.
Yes. POTS stands for postural orthostatic tachycardia syndrome. And it's unfortunate that that's the label because it suggests to most people that it's a heart problem, tachycardia, fast heart rate. And I know I was a patient disabled by this over 10 years, and my son was sick. The heart rate going up was the least of our problems. We were sick from head to toe. So as long as we still use that as the label for the illness, patients stay stuck. And it's a horrible place to be right now as a POTS patient. But something always is causing that fast heart rate. And to me, that's what the true label should be. So if the heart is racing when you stand up, you might have POTS. But if you have POTS, something is causing it. You're still not at your diagnosis.
Absolutely. Yeah, we talk about a lot on this show, the root cause, right?
Yes.
We really want to have the root cause. And a lot of this it's foreign to a lot of people because they're like, well, and this is my diagnosis and they're treating my symptoms. Yeah, but that's not really what you want to be doing.
No, it didn't make any sense to me as a patient. I remember talking to my cardiologist. He said, well, let's give you a medicine to slow down the heart. I said, okay, but I have a lot of other symptoms. Can you give me a list of conditions that would cause a fast heart rate like this that I could start with my doctors to work through them? And he said, no, we don't know that. I was like, well, shouldn't you know that? Didn't heart doctors, know what could cause a chronically fast heart rate. They really didn't. And to artificially slow it down made zero sense to me. So, yeah.
Yeah. So why don't you walk us through first, you came to this because of your diagnosis.
Yeah.
So I assume that's sort of where your messy story starts.
Yeah.
So why don't you walk us through some of the symptoms you did have that you were like, this is not right. This is not, I don't like this.
Because it wasn't subtle. It wasn't something that I could just kind of push through. But the first 3.5 years, I had times where I was almost normal. I was functional, at least. and then windows where I was horrible. But I got a virus, and it wasn't COVID. COVID didn't exist at the time, but my body reacted to it. And a couple weeks after, if I stood up, my heart would race. I felt dizzy. I stopped sleeping well. I was shaky. My digestion was out of whack. I had waves of feeling, anxious, but I had nothing to be anxious for. It was almost like my body was having a panic attack without me, if that makes any sense. And then, and then the symptoms just continued to morph. I got neck stiffness. My eyes weren't working right. I got dry eyes. The digestion went to full-blown gastroparesis. Nothing was moving.
Wow.
I developed a malabsorption syndrome that took years to figure out. It got so bad I was hallucinating. It wasn't that I wasn't absorbing or I wasn't eating nutrients. I was eating, but I wasn't absorbing them properly. And that happened to my son too. He missed over 3 years of school. He developed severe osteoporosis where he broke his arm just throwing a ball. I was putting on his coat. He was so fragile, Sarah, and no one was helping us. I couldn't understand why they were just trying to give us high salt as if we were mildly dehydrated. And so we were incredibly sick. But even the researchers, I participated in clinical trials, thought, oh, these are the greatest minds in the world.
Sure.
Answers, And at the end of that, I was worse. My son was worse. And I said, throw me a bone here. What do you think is going on? And the doctor said, well, we think POTS patients are perfectly normal. They're just more aware of their own bodies.
Stop it.
I
Stop it.
I was so shocked, Sarah. And I remember turning to my son and said, we're on our own, and just exited everything. And that's when I set up genetic disease investigators. I thought, I'm just going to do research. I'll self-fund it. I'm going to house all my research there. And then as answers came, I started to release them.
Wow. Wow. That's so incredible.
Well,
That's so
you're-
Well, no, it is. Not only did you have to become a self-advocate overnight, you had to become mama bear because now it's affecting your son. These things they're giving you zero answers, zero to go on, which I've been there. I understand that frustration. And just you decided I can't just live with this. I have to figure it out, right? So tell me, is POTS classified as an autoimmune?
No, and I think that was a big misunderstanding, continues to be. There's a fair amount of research money still into looking for an autoimmune condition that is shutting down some of the receptors in the autonomic nervous system. Instead, my approach was, I thought, I think these receptors are still working. There's no evidence like I had autoimmunity. And I figured out a way to test the receptors. They work great. So in a week, as an independent researcher, I could exit that theory, whereas these research institutions who are putting millions and millions of dollars into looking for an autoimmune condition affecting the receptors somehow didn't think to test the receptors. I couldn't
Wow.
understand it. And then when I saw, okay, the receptors are working, we have a fighting chance. And it wasn't everything, but it was a huge piece of the puzzle.
So is it like the receptors are turned off and we have to somehow stimulate them to be turned back on?
Almost.
Okay.
Through every conceivable thought on this. But what's happening is the patients are chronically inflamed, and that can come from a lot of different directions. And we see more autoimmunity for that reason, but the autoimmunity is not the cause. It's more of an effect of that inflammation. But certain elements of inflammation are blocking the release of a neurotransmitter needed by the rest and digest system of the body, so the parasympathetic nervous system. That neurotransmitter also does more than just digestion and slowing heart rate, though, and that was the big clue. It affects the ability to think, cognition, and for me, I'm an eye doctor, an optometrist. I noticed pupils were big and eyes were getting extraordinarily dry. That's a different type of receptor, but the same neurotransmitter. What we were dealing with was a blockage of that neurotransmitter. And when that was figured out, then I just sat down and go, well, we can't wait for a new drug. That's not going to happen. I don't have $7 billion, or whatever it takes. But could we use existing medications, supplements, something over the counter, if we know their mechanism of action? Could I increase that neurotransmitter and trigger those receptors, which are very viable? They work just fine. And could I cover for the genetic disorders of that neurotransmitter? Could I make sure it crossed the blood-brain barrier for the brain? I want to see the pupils get smaller to know we're hitting the receptors.
Yeah.
We needed to see a bowel movement. Then we knew that vagus nerve was working, and that's where the patents came in. So felt wonderfully validated.
Sure.
I thought, I think this is new science. I don't think anyone's figured this out before,
Wow.
So when I was sitting in my kitchen, putting things together using my ancient organic chemistry knowledge to come up with this, I had my little lab rats at home. I was a patient, and fine-tune that over years, and it's now released as Parasim Plus. Hugely important. It's oftentimes something necessary for recovery, but not sufficient for recovery. Other things are happening too, and had to figure that out also. Yeah.
Wow. So I'm soaking this up. I'm sort of a data nerd. So when you start
I love that.
I'm not sure my audience does, but I like to nerd out.
No.
So I'm like thinking of all the questions, and I want to make sure that I get them in the right order. One of them would be, so we've taken away that it is autoimmune, but it is directly related to chronic inflammation.
Yes.
And you had mentioned when you started to become sick, you had contracted a virus.
Yes.
So do we think this is environmental?
No.
Okay.
What this comes down to, and this is where 100% of my focus is now, and it started in that arena, was if we are genetically set up where we can't regulate certain forms of inflammation, we can get triggered by many things. Like for me, it was virus, COVID's a common trigger, trauma, stress, surgery, some medications, whatever. The trigger itself doesn't really matter that much. It's more the body's abnormal response. And genetically, we're unable to regulate it. We can't calm things down. So inflammation, as you know, is necessary. It helps us prevent disease. It helps us manage infection, etc. But if you can't turn it off, then it does damage. Damage causes more inflammation, and then we start cycling down. Symptoms multiply. Ultimately, the cardiovascular system is affected, the blood vessels, the heart, and the neurology, as I talked about, can be shut down. And interestingly, intracranial pressure is easily affected, and that was another huge piece of the puzzle to figure out.
So we're talking like migraines, or
it can be misdiagnosed as a migraine.
Yeah.
Migraine very specifically is a vascular headache. We oftentimes use that term for just really bad headaches, but intracranial pressure is where there's an imbalance in the production of cerebrospinal fluid and the drainage of it. And that fluid surrounds the brain, goes down the spinal column, it supports the brain, it allows the waste, et cetera, to be flushed out. And interestingly, it goes down the optic nerve of the eye. And I'm an eye doctor, right? So when I was dealing with this and had no answers, the first study we did was we brought in patients, 30 patients and 30 aged matched normals. And we did every ocular test possible on them. And I was the blinded doctor, meaning I was presented with like images of the back of the eyes, and I wasn't told he was a patient. And I had to guess. And one thing I noticed was there were vascular differences in the patients, and got pretty good about identifying who was a patient just by looking at the images. The images were not something as a professional we would have looked at and gone, oh, that's not good. We need to send you out, to a specialist. But it wasn't normal. There were things like plaque development, even in like my 9-year-old son. Why would there be plaque development? The veins weren't smooth. The caliber should be smooth. There's a certain ratio to the artery to vein size, 2 to 3, and that was abnormal. And that was a huge clue. And we learned that, okay, if this is a chemical attack on the cardiovascular system, and that's what we're seeing in the blood vessels, can we fight back chemically? Right. And that was another avenue of research. So when I was looking at the optic nerves of those images, those weren't quite right either. And it wasn't to the point of saying the optic nerve was swollen, which is what we look for to diagnose high intracranial pressure, but it was different from the Naughton patients.
Wow.
So we went down that road. And indeed, probably 95% maybe of the patients we see at POTS Care have high intracranial pressure, but it's easy to miss because it doesn't always display as normal. It's very treatable. It's a secondary problem, but it's a significant one. And oftentimes, if we just relieve that pressure, patients will feel the hope of survival for the first time since they've been sick.
Wow.
Yeah. So another key piece. There's
That's
usually
huge.
yeah, and that was another layer.
So talk a little bit then, on this podcast, we're often, if it is autoimmune or other things, I'm a T1D, I have Hashimoto's, and we're constantly talking about nutrition and how that plays a
Yeah.
role. And so is
Yeah.
there any element piece to this where nutrition can maybe not solve it, but help?
Yeah, it's interesting. We see a fair number of Hashimoto's patients. And Hashimoto's, I think it warrants special attention because the antibodies there do affect the cardiovascular system independently of the effect on the thyroid. Patients can be sick. I know I'm probably preaching to the choir. No, it's
Okay. That's okay.
that are independent of any effect of the thyroid, or they can be sick before the thyroid's even affected. But in my eyes, a patient with Hashimoto's, even before the thyroid is affected, is going to be more prone to developing inflammatory POTS because their cardiovascular system is already under onslaught.
That's
of
so interesting.
antibodies. Yeah.
Just and, my audience has heard it, but I'm not sure you're aware. So I had a heart attack 3 days before I turned 43 years old, and it
Oh,
wasn't due to high cholesterol, and it wasn't due to high blood pressure. It was what
yeah.
I was told was copious amounts of stress and, high blood sugar, being a type 1 diabetic. But it has never made sense to me, and of course, they gave me the standard American cocktail of the medicines I was supposed to take, and of course, I went full carnivore and went off all my medicines, and it
Yeah.
has helped. But when you're talking about specifically the cardiovascular system being affected
Absolutely.
and knowing that I have Hashimoto's, I'm listening.
No, absolutely. I do not know why that's ignored. Why, when someone is diagnosed or antibodies are found, they don't just jump all over it to take good care of your blood vessels. But honestly, I don't think that's a thing. I remember talking to my cardiologist saying, I respect the fact you save people's lives, when they have a heart attack or you stent or whatever. So, but what about people with this vascular inflammation? It does make you more prone to clots. The first thing we do at POTS Care is check for clotting, the very first thing, right? Because that can stop you in your tracks.
Sure,
Right?
sure.
But I said, what about the health of the medium and small vessels? And I said, think brain, think kidney, think quality of life. And he said, oh, yeah, nobody cares about those. Oh my God.
Just stop it. Oh my
He
gosh.
said, if someone develops dementia from small vessel disease, I'll send them to a neurologist for treatment. If someone develops kidney disease, I'll send them to a nephrologist.
And
I said,
at that point, it's
too
too
late.
late.
Thank you.
At that point, we've passed the point of being able to do it. Like, that's crazy to me.
It is crazy to me too, but there isn't really a doctor for that. So I put out a brochure. I need to have this available to you or anybody else who wants it. Is what are the top 4 things I would do if I was just diagnosed with POTS?
Oh, let's hear it.
People were expecting things like high salt, Gatorade, beta blockers, whatever. Nope, not on there. Number 1, check for clotting. Number 1, because again, that can just stop your tracks, right? They were expecting dietary changes or exercise, and I don't want to poo-poo that. But when I got sick, I taught exercise classes. I was in great shape. Nutrition was a hobby of mine. I it wasn't like I was eating poorly and was, out of condition. That wasn't the case. So I didn't understand why they would tell me you need to eat healthy and exercise. I was already doing that.
Mm.
That wasn't like that was going to reverse things. Having said that, you can get deconditioned, especially if you're bedridden. And my eating just started to go south because
Sure.
just in survival mode, right? And then eventually I was just, if I ate, it was comfort food. I didn't care if
Of course. Yeah.
yeah. Okay. And that can make us feel worse. So dietary, you'd asked. Most inflammatory patients do fairly poorly with sugar. Processed foods usually work against them. And a balanced diet turns out to be important. I've seen many patients go vegetarian and then still have fatigue. So if we mix it up a little bit, they tend to do better. But other things to consider in that top four, the risk of high intracranial pressure. If those symptoms are there, like insomnia, neck tightness, pain at the base of the skull, brain fog, etc., then have that evaluated and treated.
Yeah.
That could be changing. And interestingly, antihistamines can be helpful.
Yeah, I read a little bit on your thing about that. So get into that a little bit. Yeah.
Yeah, many types of inflammatory cells kick out histamine, and they kick out a lot more than histamine. But histamine is a big bad chemical on the blood vessels. It damages the inner lining, the endothelium. It makes them leak. We're more prone to having vasodilation with histamine. It's why we get flushed. Sometimes the blood vessels are dilating, blood tends to pool. So if we block histamine 1 receptors on the blood vessels, like with Zyrtec, in just a couple weeks, patients can sometimes feel better. And then in the gut, the histamine 2 receptors are blocked with Pepsid AC. You can't stay on that long term, but for short term, sometimes with patients, that's really helpful, especially if some of the inflammation is in the gut. And we look at symptoms of digestive problems, sensitivities, etc., to help figure that out, that and blood work. But yeah, blocking those chemicals that we know can be a problem is helpful.
Yeah. Yeah. And would you say if you've reached the point where you're having sort of that histamine flare up, it probably means you're having a whole body flare up and it's trying to get your attention to be like, okay, wait a minute, time out.
It is. I think what we want to consider is it's not really truly a histamine problem. It's an inflammatory problem. And when that's identified and treated, the histamine problem, goes away. But while you're working through that and doctors are identifying any causes that could be happening, then do block that chemical. Yeah. For foods, what we look at with POTS, it's kind of interesting, Sarah, where usually a POTS patient who has some inflammation in the gut can eat something that gets them going, and 30 minutes, maybe an hour later, their heart rate's picking up. And we know that food is triggering some of those inflammatory cells, and we just set it aside for a while until that's better treated. And then usually they can bring it back in and do just fine. But we watch for heart rate to see if something they're eating is problematic or not.
Yeah.
Yeah. Huge.
Wow. And so it seems like, especially this day and age, we're sort of in a chronically inflamed world anyway, right? That's why we have this abundance of autoimmunity and chronic conditions and all of these things that are happening.
Right.
I mean, certainly it has environmental things, food thing, we're having big discussions about what's in our food nowadays and all these kinds of things. But it sounds like in this particular case with POTS, your body just can't handle it, right? It cannot, I think you use the word drain, so to speak. And so that's a whole other system that has to be tapped into on top of the chronic inflammation in and of itself of all of these different systems in the body that it's attacking. I mean, this is a problem.
And think in terms too of inflammatory patients are sensitive patients. And the more inflamed they get, the more sensitive they get. I certainly was one of those. I was down to maybe 2 foods, and both of those were problematic. My son, he almost died when my mother-in-law sprayed Lysol once. It
Oh
was
my goodness.
sensitive to soaps and chemicals. We had to
Yeah.
wash his clothes in water. We couldn't even use soap.
Wow. Wow.
Um, but as the inflammation goes down, the sensitivities go down. And what I hear from our patients is the patients will say, well, I'm much more sensitive than you've ever seen before. You go, no, that's pretty well put. I go, oh no, but mine's like through the roof. I go, yeah, that's pretty much it. Because we don't see like the easy POTS patients
Sure.
and just got POTS, they're gonna be fine.
Right. They're coming to you on their last leg and they're completely frustrated with the system and what they've been told. And they're like, please help me.
Or they've heard my journey and it sounds like I'm talking about them, with some of the symptoms. But yeah, it can be a big bad condition. And what also tends to come with it is as inflammation goes up, oxidation goes up, and oxidation further damages the blood vessels, ultimately organs, and it changes the brain chemistry. And the brain chemistry leans more toward an anxiety type of presentation. And sometimes it exhibits like anxiety. Other times it can exhibit as more like an OCD, attention to detail, high achievement. We tend to be like at the top percent of everything we do. But we could become crippled by it. We can certainly have trouble living with other people because we expect them to have the same level
They don't.
of detail, right? What? So although we're very high achievers, when we get sick, you're trapped in this body that won't cooperate. Your brain is moving 100 miles an hour. You have all these goals, all these things you want to do, and you're in this crippled body that won't cooperate. It's just a horrible form of torture. It really is.
Well, that, and then maybe they're diagnosed with anxiety, then they're giving these anti-anxiety meds, which probably aren't good to begin with. And so maybe they feel better for a minute, but then they're still left with what the root cause is, and we're still not
That's
getting
right.
to the bottom of it.
That's exactly right. I was so, frustrated, yes, but I was also stubborn in that when they suggested anxiety, I was like, well, that's not it. I got a virus and I didn't suddenly develop a psychiatric condition. So let's think a little bit deeper.
Sure. Yeah.
But
Yeah.
to the uninformed, that's what it looks like. And I feel very fortunate that I got sick before my kids.
Mm.
Because if I had not gotten sick first, I wonder, would I have looked at what they're going through and wondered, is this just a psychiatric thing? But I knew it wasn't. And there was no way I was going to let a doctor slap a label like that on me or my children.
Yeah. Yeah.
So instead, we had to figure it out.
Wow.
Fortunately, we did.
Yeah, no, that's incredible. The work that you have done, what you've been able to bring to the forefront, that is just so, so incredible and so necessary. People need to know this. They need to hear this information.
Absolutely.
And even if it's a case of maybe it isn't POTS, but talking about the inflammation and
Yes.
how that attacks your body, that's so important.
Yes. And that it's not the patient's fault. And I think when doctors frustratingly get to the point, they want to help people. That's why we go into medicine. And when they don't understand why someone is that sick, they get very frustrated and they'll tend to run through, well, I've gone through everything I know, so it must be your fault. And you get the look from the doctors. Oh,
Yes.
I remember
Yes.
that look.
I've been there.
Oh, you're one of those.
Yeah. Yeah.
Oh,
And then they start to gaslight you and then they start to make you feel crazy. Yes, I've been there so many times. And it's just, again, I think that's probably why it's called practicing medicine. And so I understand, but we know our bodies better than anyone. We know when it's not right. And it's hard to put that into words. And speaking with a medical doctor sometimes is intimidating because they're supposed to know everything.
yeah.
And it's hard. Yeah, well, they are.
Mm.
Well, when I found out over the span of a medical doctor's education, they spend an average of 4 hours on nutrition, and that's it. When I found that out, I thought, okay, I'm not saying I'm smarter than a doctor. I'm not saying that I know everything, but when they're not even looking at that component of what we're dealing with,
That's shocking, right?
absolutely.
Yeah, no, I'm 100% with you. That is shocking. I got a case published in peer review where she was having pseudo seizures, and she had them for what, 3 years? I think she was 23 at the time, and it looked like a seizure. They'd last, 30 minutes or so every day. And the doctor said, you're going to have to learn to live with these. Well, she can't do that. And she's completely disabled. This was just one manifestation of it. But I saw a clue in the back of her eye. It was a tiny little dot that had a white center. And there has never been a published case of this, but I wondered because we look for deficiencies because of the vagus nerve problem. She wasn't on Paracin Plus. I knew the vagus nerve wasn't working well. Could she have malabsorption? Could that be a clue to a severe vitamin B6 deficiency? And
That's so specific.
I
That's
know,
so
right?
oh my goodness.
In babies, if they're unable to break down vitamin B6 to absorb it, they get those spots in their eye. And you never see them, but you learn academically that can happen. But there'd never been a case of an adult with pseudo seizures with that deficiency. And indeed, that's what it was. We stopped her pseudo seizures in 2 days. And then 4 days later, the spot went away. And
Because of your supplement?
yes. Well, we also
Wow.
for B6.
Oh, okay. Okay.
Yeah.
Yeah.
But that's why she wasn't absorbing. She wasn't just B6 deficient. She was deficient, across the board, but that one was manifesting neurologically and vascularly.
Wow.
And we got lucky in seeing that. Yes.
That's
So,
wild. That's so incredibly wild.
I too had symptoms of every deficiency out there. Like I said, I was hallucinating. My neurologist is smart. I mean, neurologists are fairly smart.
Sure. Sure.
He never dreamed it would be a nutrient absorption problem. I wasn't an alcoholic or celiac or Crohn's or whatever. I was eating. I didn't have an eating disorder. That would never occur to them, right? And the blood test for many nutrients isn't always accurate. So for a while, we mega dosed vitamins while then starting Paracin Plus, got the nerves working again, and over months normalized that absorption process again, praise God. And my son was able to recover from osteoporosis.
Wow.
His growth had stopped. As a mom, it was just horrifying. He should have been in his growing years.
Sure.
Stopped. So he was able to grow again. And the brain recovered.
That's crazy. So I'm sure it's a proprietary blend in your Paracin. I'm sure there's that. But when you're able to sort of pinpoint these nutrient deficiencies, are they there's a group that's normal with it, like the vitamin B? Is there anything else that you're like, oh, you're nutrient in this? I bet we need to look at this.
If there's anything across the board, when the blood tests are just not great.
Right.
Like magnesium, for example. We see so many magnesium deficiencies, but to really get an accurate magnesium, you have to do a biopsy. We're not going to be doing that.
Right.
The
same way they test vitamin D. They test the inactive part of the vitamin D, not the active part of the vitamin D. So you really don't know how much is going on in your body. They just say, oh, you're vitamin D deficient.
Right. Vitamin E is kind of similar. And then the water soluble vitamins are so transient. And then some of those can go high as an inflammatory reaction. It's an artificial reading. So instead, we look at the symptoms, we look for inflammation, we look for vagus nerve or neurotransmitter problems, and we fix it. And then we don't have to stay on vitamins forever. The idea is to get the nutrients from your food.
Right.
Right. It took me, it was probably 2 or 3 years before I felt comfortable going off of vitamins. My eating was still great, but I was afraid that what if I went off of them and I still wasn't absorbing as well as I could? I didn't want to go back to that horrible fatigue and hallucinations and everything else. But eventually I was able to go off of vitamins and just use my diet and did fine with it. And so did my kids. But for a while, sometimes we need a fair amount.
Yeah. Well, and it's so refreshing to hear you say there was an end, right? Most of the time,
Yes.
like especially in my case, I'm told, well, you'll be on this medication the rest of your life. And that's period. And you just have to deal with it. And it's like, I don't accept this. Why is it for the rest? I mean, the insulin, obviously, there's nothing I can do about that. But the others, having to be on Armour thyroid for the rest of my life or these other things, when I know I can treat it with selenium and L-lysine and all of these other things that they don't even talk about. And it's like, I have been able to significantly reduce the dosage of my Armour thyroid, obviously not get rid of it completely, but enough to be like, "Okay, I made a small little improvement of something," you know?
Yes, and that's wonderful that you're taking that into your own hands. And I would encourage you and all Hashimoto's and diabetic patients to really focus on vasculature because there isn't that much out there on it. And do pay attention too if the inflammation due to the autoimmunity is affecting the neurotransmitter, you get a pattern. You start to see it, sluggish digestion and faster heart rate, more emotional, labile emotions, how we say, um, more forgetfulness, that sort of thing, and that can be replaced with
Well,
paracetamol.
that and you put that all into the pot, and then you had perimenopause. I wanna go to bed and just
It really bothered me when I first went to the doctors. They said, "Well, let's check your hormones," and I had this snarky little response. I felt so Oh, I wasn't taken seriously, right? And I said, "The last time I checked, hormone changes don't cause autonomic dysfunction." That
Thank you.
you are minimizing my symptoms. And they checked the hormones, they were fine. But then later I did go through perimenopause, but I knew it wasn't a hormone issue. This was an illness that they were missing. We were teasing in our Patreon group, the men, they're checked for drugs and the women are checked for hormones. But usually both of those are okay, right? It's very easy, though, in going through perimenopause to mistake an inflammatory episode as a hot flash. But it's like it's a
Oh.
hot flash from hell because you don't just get hot. Your heart rate goes up and you feel real panicky. It'll take people to the emergency room. And those are inflammatory, those are not hormonal. So I really feel for people who are going through perimenopause, menopause, and they're trying to differentiate a hot flash from an inflammatory episode. That's
Ah,
really difficult to do.
wow. Just keep adding on, doctor, just keep adding on. I'm not gonna quit.
Someday we're going to have better labels for these things. And I think Hashimoto's, unfortunately, is seen as a thyroid problem. That's just wrong. It ultimately can affect the thyroid, but it's an inflammatory autoimmune condition. And then for POTS, that's a horrible label. That doesn't help anybody. It's just like saying it's a fever. It doesn't say anything about the cause of it.
Right.
So my goal is to have the genetics laid out, and then we can measure for things in the blood, and both of those are objective, and we know what we're doing.
Wow.
And the patients have the validation they need. Things like chronic fatigue syndrome, or fibromyalgia, POTS, that doesn't validate the patient's suffering.
Exactly,
And it's
exactly.
blown off by
Yeah.
way too many people. These are significant illnesses. Probably 40% of the patients we see at POTS care admit to having tried to kill themselves at some.
Oh, God, that's heartbreaking.
Yeah, well, you
That's
can
heartbreaking.
handle so much. It
Right,
is
well, yeah, yeah.
tragic.
Well, and just speaking on your validation point, I know for me,
Yeah,
when I did start to see some of that validation, that actually spurred me on to learn more and do more and wanna pay it pass it on
yeah.
because I was like, "Oh, there is an answer or there is something." And so just that little bit to say, "You're not crazy. This happening to you," that
Right?
helps people.
Yeah, no kidding, no kidding. This should not be happening, honestly. And I hope it's soon. I like to think 10 years down the road. Um, Doctors will say, "Oh, your heart rate's going up when you stand," or "You're dealing with this, that, or the other I don't recognize." Let's do an inflammatory cytokine panel and see what we're up against.
Absolutely.
Or that in a genetic panel. Okay, because it'll only be $100.
No,
We'll be
absolutely.
able to identify what's falling down. And I do also think you talked about it's an inflammatory world right now. As we get older, we get inflammation increase. It's called inflammaging. That's just a normal process. But I wonder, why aren't we more proactive on that chronic inflammation? And maybe we can avoid some of these older age illnesses. I'm old, and I don't have them. I don't really want to get them because
Sure.
I'm sick. So I'm very proactive, vascular health, inflammatory conditions, the brain. It's very important to keep all that in place, and maybe we can age much more gracefully.
Absolutely. Well, and I love what you said there too, because I am constantly saying this, and it kind of goes hand in hand with that. Not only do we need to be proactive in the things that we can control and we are knowledgeable about, but we need to become the very best patient advocate that we can, because and have the list that you see or find from people like yourself to go into your doctor and be proactive in saying, I need this test. I want you to check this. Not because we're trying to be Google doctors and tell the doctor what to do, but because it might save them time, because
Yeah,
we are asking the right questions, and then they might
yeah.
be like, "Yeah, let's do this." Like, that's so important.
And if your doctor won't do that, you need a different.
I say that all the time.
And we talk about this on our Patreon group. It's exhausting, that you have to basically figure this out yourself and try to get the medical care that you need. That's just exhausting. But right now, that's kind of
Yeah,
necessary.
you have to. You have to.
Shows like yours are so helpful to bring forth things to help people who are trying to negotiate this difficult medical state right now, by themselves,
Yeah,
which I am a doctor and it was hard. So
right.
I can't imagine not being in a medical field and trying to figure this
Figure
out.
it out. Figure it
And
because we have sort of been told it's not for us to figure out. That's why we have the doctors to go to. But then when we're left with nothing, you the crazy look, that does like, that can't be it. There has to be better out there, and I've always said I long for a world where we can take modern medicine and traditional old world medicine and marry it together, because I believe we're missing fundamentally, especially in the modern medicine, we're missing where they're just treating the system of the body versus
right.
the whole body. We're
Yeah.
missing pieces there, and we have to marry that up. It has to be married.
It's so sad, but along my journey, I did learn that so much of medicine research revolves around, I know this is shocking, money.
Right?
And
We talk
there's oh, there's
follow the money.
like new drugs and stuff, but I don't think we always need new drugs.
No.
I think if we know those mechanisms of action, we can figure things out. Um, but that's what people are motivated by. And I was horrified in my journey to learn what was motivating people, that it wasn't benefiting patients. Um, for some reason, I thought that just everybody wanted the answer.
Right. They don't. They don't. And that's why we now have this society we live in that's a pill for an ill, because that's what they want. They want that easy fix. I don't care. I mean, you ask a lot of these people who are on this medicine and you say, well, do you know what the side effects could possibly be on this medication? No, I don't know. Some of them have black box labels on them and you have no idea what you're taking. And it blows me away. Like, we just need more people to be informed. We just do.
Yes, and we see this a fair amount. Just, my area is eye disease, and they're coming up with new drugs. I don't know that that's going to actually be required. If we can pick apart these things, we can likely use existing medications. So, but it is what it is. You're
But
right.
there's no money in that.
Exactly right. Oh, I was traumatized, straight up traumatized when I first was exposed to that. I was so horrified by it. I got a little bit thicker skin, now, but it was shocking to me when I first came up against these brick walls, basically for that reason. So, oh, but the empathy I feel for patients going through these things never stops, because it just brings me right back to where I was emotionally. And
Because you know the
yeah,
suffering.
I will do anything to help someone pull out of that. That's just a horrible place to be. So you get sick long enough, that motivation stays, the empathy stays. I'm here to help. And I
Mm,
really want to change how these conditions are labeled, evaluated, managed, etc., before I exit stage left. So that's
absolutely.
kind of my goals now.
Well, Dr. Driscoll, you are doing such amazing work. I am so, so grateful that you were here to share with my audience what you're doing. Somebody wants to work with you. If somebody's like, yes, that's me, how do they get a hold of you?
Yes, I'm at potscare.com. And the patented supplements are on vagusnervesupport.com. I also call it TJ Nutrition. I named it TJ after my kids.
Oh,
So we put those on that. And there's other places I'm try to reach out to people in many places as I can, but those will probably get you to me.
All right. And we'll put all that in the show notes. Again, thank you so much for coming and spreading this awareness and for the work that you're doing. I'm so appreciative of that. And thank you so much for coming on Everything's
I
Messy.
appreciate I'm so grateful. I'm just one voice, but you can amplify that voice and we can reach so many other people. And there are so many people suffering that shouldn't be. So thank you for your
Thank you so much, Doctor. I appreciate your time.
work.
Thanks for listening to Everything's Messy podcast. Whew, if you made it this far, give yourself a gold star or at least a nap. Honestly, if you showed up today and you were listening, you've already crushed it. I'm so grateful for you listening. If anything hit home, share it, tag me, write it on a sticky note. I don't care. Just don't keep all of this messy goodness to yourself. You can find me on Instagram at Everything's Messy Wellness or over at my website, everythingsmessywellness.com, where I've got resources, coaching, and probably a new rant about blood sugar or something that's just nonsense. It's all waiting for you. Check out my YouTube channel. I've got all of my podcast episodes up there. And I'm on X at Everything's Mess. Or if you just want to send me an email, Sarah at everythingsmessywellness.com. Look, until next time, hydrate, take no crap, and as always, keep it messy.